All right, welcome. Today we're diving into something pretty interesting. It's a clinical guide from Aum Ayurveda Care, which is an Ayurvedic center over in India. What we're going to do is break it down piece by piece to see how an ancient practice like Ayurveda presents itself to you and me, a modern audience. Let's see how they do it. Right out of the gate, you see this mix of the old and the new. The very first thing they do is point you to a YouTube channel. Now, this isn't just about looking modern. It's a really smart move. It's all about building trust and authority on a platform we all know and use, placing this ancient practice right in our digital world. So, first things first, who exactly is Aum Ayu Care? Well, the guide calls them an Ayurveda and Panchkarma multi-specialty center. Now, for those of you who might not know, Panchkarma is this core set of detox and rejuvenation therapies in Ayurveda. So that title alone tells you a lot about their focus and what they offer. And who's at the helm? That would be Dr. Pranav Shah. The guide makes it a point to highlight his credential, an MD in Ayurveda. And that's not just a fancy title. It's a huge deal for building credibility and assuring potential patients that they're getting a high level of expertise right from the get-go. Okay, so we've covered the who. Now let's get into the what. This next part is all about the specific conditions and health concerns the clinic says it specializes in treating. The guide is super clear about what they tackle. So, what exactly are their areas of focus? Let's take a look at the list of health issues they're going after. And wow, what's really striking here is just how wide-ranging this list is. I mean, you've got everything from chronic issues like diabetes to lifestyle concerns like obesity, and even very specific conditions like PCOD, which is polycystic ovary disease. This diverse list really suggests they're aiming to treat the whole person, not just, one isolated symptom. So we've got the who and the what. Now let's dig into the why. The guide lays out this 5-point mission statement that really gives us a clear look into the clinic's whole philosophy. First up, their mission is all about education. By saying they're a source for authentic Ayurveda information, they're telling us that fighting misinformation is a big part of their purpose. They're not just treating patients, they're trying to educate them too. Next, this is where they connect the dots between the ancient world and our crazy modern lives. This idea of providing practical healing insights for modern life is so important. It tells you their approach isn't about running away from the present, but actually weaving these traditional practices right into the world we live in today. They also circle back to that core service we talked about, Panchkarma. By saying flat out that they're dedicated to explaining this detox therapy, they're not only highlighting how important it is to them, but also showing a real commitment to making sure patients understand what's happening. Now, this point is all about the patient experience. The promise of an easy and comfortable treatment, well, that's designed to make it all feel less scary, right? It could really help ease the worries of people who might think these traditional therapies are kind of intimidating or difficult. And finally, this is all about transparency and what we might call social proof. Putting patient reviews front and center shows they're focused on results and they're willing to let the experiences of past patients build that crucial trust with new ones. So we've explored their big mission. Now, how does that philosophy actually translate into the services they offer? How does this all turn into actual treatment? Their whole approach really comes down to this simple two-part structure. First, you have the Ayurvedic consultation to figure out what's going on and make a plan. And second, you have the Panchkarma treatment itself for the therapy and rejuvenation. It's a really straightforward and easy to understand model. This brings us to the last and maybe the most practical part of this whole thing. We've talked about the who, what, and why. So now, let's get to the how. What are the actual steps to become a patient? They make the process for becoming a patient super clear. You need an appointment beforehand, you have to call to schedule it, and you have to call during business hours. This sets up a really structured professional system. It's not a walk-in clinic, it's a planned, appointment-based practice. And here it is, all the essential details in one simple, clear table. You've got the phone number, the hours, the address, the website. Basically, everything a potential patient could possibly need is right there. This kind of transparency and easy access is really the foundation of their entire guide. So, what's the big takeaway from all this? When you piece it all together, Aum Ayurveda Care presents itself as this multi-specialty center that is very, very intentionally blending the deep, ancient roots of Ayurveda with the practical needs and communication styles of modern life. And that really leaves us with a final, pretty thought-provoking question that this whole guide makes you ask. In a way, it's a perfect case study. So the question is, How is ancient wisdom being packaged, communicated, and ultimately sold to a modern audience? This guide gives us one very clear, very structured answer.